Okay, guys, so let's try it here. Atherosclerosis. Who is gonna describe this for me, please?
So it's the hardening of an artery wall caused by the buildup of a plaque in the inner linings of the artery. So it's like fat
It's like
on
what?
the fats on the artery wall.
Hmm. Right. So, and in its simplest terms, as you're saying, is the narrowing of the artery by the build up, oh, sorry, of fatty deposits. Can anybody tell us or make a contribution? Where does this fat come from? Where does these fatty deposits come from? Anybody? Victoria, Chrissy,
So
Priyanka?
like from food.
From food, from your diet.
Yeah.
Right. Hmm. Sorry about that. Yeah, so your diet is one part of it, right? Now, if you guys do some research, you will look at your family history and all those things and the increased risk and all that stuff. So yeah, in a nutshell, atherosclerosis is narrowing of the blood vessels via the buildup of fatty deposits on the inner wall, right? The inner wall of the artery. So I will encourage you guys to take down your little descriptions. Um, the session has been recorded now, so I'll share it. Just a little hint, this is directly in line. This is directly in line with the unit um, outline. Okay, next one, emergency. Who wants to describe what an emergency is?
I'll go ahead for this one.
Can you speak
An
up a little bit
unexpected.
for all of us?
No problem. Is this any better?
Yeah, that's good.
Okay. An emergency is an unexpected and urgent situation that requires immediate action, often to prevent serious harm or save a life.
Mhm. Okay. Anybody want to add anything to it, or are we okay with that? Anybody? Everybody okay with that? So the key thing here is sudden. It's sudden, it's unexpected, it's unplanned, right? Hence the reason why we describe it as an emergency. So, and based on that, we can plan for emergency situations and we utilize previous incidents to help us with our planning and development of mitigation measures and response measures and so forth, right? But yes, emergencies are sudden and unexpected. Okay. Part of occupational health and safety is planning for these situations. So in the event it actually happens, we we're not gonna get up today and say Joe Blow from office the second floor office 5 is gonna have a heart attack. No. What we could do is have training done. So in the event somebody in the office has a suspected heart attack, we know how to respond. We know what we can do. We're not gonna come to work today and say, oh, you know what? I feel I could go back home, but I'm gonna burn down the building. Right, Tanya?
Yes, sir.
And Anjali, correct? We're not coming to work today and say we're gonna burn down the building.
Yes, sir.
Okay, okay, Soraya?
Yes, sir.
Right, good. So, but what we could do is have proper planning. In the event there's a fire, in the incipient stages, our safety wardens can know what to do. Alert the responding agencies or alert the proper authorities. Evacuate personnel to the muster point or the emergency assembly point. Have someone do a head count. If it's a small fire, and you can use attempt to use a fire extinguisher if you're trained. But again, it's proper planning. In the event it happens, hence the reason we look at emergencies as being sudden and unexpected. All right. Who take the easy one? The next one. Who's next? First aid. Who took that?
I could give the definition or what I have.
Right. Go ahead.
I have the immediate care given to someone injured or someone ill before professional medical help is available.
Right. So it's immediate care and stabilization. And I don't think we anybody's gonna disagree with you. All right. So yeah, I am okay with that. Anybody else want to add anything to it? I highly doubt it, but the key thing here is immediate, immediate care or immediate stabilization being provided now before the arrival of other healthcare professionals. Okay. So thanks. Nice. Injury. Somebody said they were doing injury. One of the guys. Grab
Yes,
it.
sir.
Yeah. Jamal, go ahead, partner.
So injury is a physical harm or damage to the body caused by an accident or fall impact that
Mhm.
affects any part of the body.
Okay. Right. So, yes, sir. Right. Anybody want to add anything to it? Nobody? Right. So it is some force impacting on the body. That's right. That's correct, Jamal. Some sort of external force impacting on the body, right?
Correct.
Good. So typically, when we look at trauma in emergency care, trauma is any external physical force impacting on the body, resulting in subsequent injuries to the person. So yeah, cool. Um, what I would like for you guys to do for me, right? Um, I would like for you on the WhatsApp chat to put for each one of the topic what you guys your description was, put it there. And I would like one person to compile it for everyone. Or you just put it and leave it on the chat there and it's available for everyone. Up to you guys. But just put it on the WhatsApp group. Just put it on the WhatsApp group, please. All right. So thank you, Jamal. Airway. Who did airway? Right. Go ahead.
I have the passage by which air reaches a person's lungs.
Anything else you want to add to that? Anybody want to help her? Just two words you're missing there. Think about it. Just repeat what you said. You're correct, but you got one part of it. We need to add the other part. And to add the other part is just two words. Let's read it back again for me. Say it back again.
The passage by which air reaches a person's lungs.
Miss Thompson, just hold one sec. Let me just hear her again. Yes, Priyanka, go ahead.
The passage by which air reaches a person's lungs.
Right. That's one part. What happens when air reaches the lungs? Anybody jump in and help her here?
Exchange of gases.
Right, so we have gas exchange, right? Good. What next after we have gas exchange taking place?
Diffusion.
No, we're not going into the movement of oxygen and carbon dioxide in the bloodstream. We're just staying with the airway, right? We're staying on topic here with the airway. So after you inhale, you have gas exchange taking place in the lungs in the alveoli. What happens to that air? What happens to the air afterwards? Somebody? Anybody?
The air would be exhaled.
It's exhaled. So, Priyanka, what you would want to do for this, just modify your answer to include movement of air into and out of the lungs. That's it,
Okay.
right? Just two words, and out, because you have air moving into the lungs, right? But remember, air moves in two directions. Into the lungs where we inhale, out of the lungs when we exhale. And this is the process, right? So the airway is the pathway. That's it. The airway is the pathway. Okay, good. I skip one by medical emergencies. Who did medical emergencies? Anybody?
Medical emergencies. Any emergency that merits the immediate intervention of a medical practitioner, such as abortion, accident, and suicide.
You're breaking up real bad. You're breaking up real bad. Right? So let's go back to the first part of your statement. So it is a condition, or it is a situation, or as you said, an emergency that warrants or needs immediate medical attention or intervention. Now, interestingly enough, when we think about medical emergencies, we think about in hospital, but that's not the only place. Emergency care has evolved to the point where we have so many highly skilled and highly trained professionals functioning pre-hospital, outside of the hospital. So when we're looking at medical emergencies, it is any condition or any emergency, sorry, where any, okay, what's up here, right? Any, um, I lost my train of thought here. Just give me one sec, let me get it back. Right. So a medical emergency is, we could describe it as, just as you're saying there, any health condition or situation where immediate care slash intervention is required by a medical professional. Of course, we have a host of the descriptions, right? Or examples from the hmm, from the cardiac emergencies, as our colleague was saying, the traumatic injuries, right? We have the airway situations and all those. Okay, right. And it's very simple descriptions I'm looking at, right? Ms. Thompson, is not necessary at this point in time to go through the process of diffusion and alveolar respiration and all those things, right? It's not necessary at this point in time. Okay, let's look at a pulse.
So it's just P at A and P along here with your subject, so it came
Yeah,
up.
no problems. I understand. That's cool, right? Maybe I should have my daughter in this class, with some of you guys. Um, Yeah, so a pulse. What is a
So
pulse?
I have the rhythmic expansion and contraction of an artery's wall caused by the blood pumped into it by the heart.
Mhm. Right. Say that again. A little bit slow.
The
A little bit
rhythmic
slower for me. Yeah.
expansion
Just
and contraction.
hold on.
So you hear me clearly, no?
Yes, no. I'm struggling here, guys. I'm struggling. Um, right. Go ahead a little bit slow because you know my condition. So go ahead.
The rhythmic expansion and
Mhm.
contraction of an artery's wall
Mhm.
caused by the blood pumped into it by the heart.
Right. I'll take that. Anybody else want to add anything to it? And that's exactly what it is, right? Remember, when your heart contracts, it pushes blood out into the main artery, the aorta, and you get this contraction in waves, right? The heart will contract, relax and fill with blood, contract again, relax and fill with blood, and each contraction, as you rightly said, is it's a rhythm, and that's why when you check your pulse, you feel that beat, whether it's at your neck called the carotid pulse, or your wrist called the radial pulse, or at the groin there, the femoral pulse, down at your feet by your ankles and on the inside there, the posterior tibial, the dorsalis pedal, those areas, doesn't matter. You feel the pulse as your heart contracting and relaxing, pumping blood out. So thank you. Right. Next, what's an injection?
So I have an injection is basically the use of a needle to deliver a liquid like medicine into the body tissues.
Okay. So who said that?
Sanjaya.
Sanjaya. Okay. Um, Russell, I'm thinking about something here. Just repeat it one more time for me. It is
The use of a needle to deliver a liquid like medication into the body tissues.
okay. All right, I'll look at that. But just bear in mind, we also have situations where insects and animals can inject toxins into our bodies as well, right? In almost a similar manner. Just keep that in mind. But for the purposes of this course outline here, I'll take that. And I really and really want to look at it being the um, okay, yeah. Guys, I need a break. I need a 5 minutes. Sorry, I'm Sanjay, but I need a 5 minutes. All right. So, guys, just give me a couple minutes here, and I'll come back. All right. Okay, good. So, who looked at arteries? Yeah, go ahead.
So for arteries, I heard is a critical part of your cardiovascular system that are blood vessels which distribute oxygen-rich blood to your entire body.
Mhm. Okay. Now remember, arteries typically carry blood away from the heart. right? And their walls are usually thicker than veins because the force to be able to withstand the force of the blood that's been pumped through them. Okay? Right. So as I said, very simple descriptions. What is so the next one, what is the body? Anybody? Who did that? Who looks at that one? Somebody want to say, please?
Uh,
Yeah, Vincent, go ahead.
um, the physical structure of a person or animal that includes bones, flesh, organs, etc.
I feel like we're looking at the same thing online here, boy. Yeah, no problem. Thanks. And that's what it is, right? Okay. So, all right, make sure you put it on the chat, right? For everyone to have it. Next one, shock. What is shock? Who looked at shock? Anybody who looked at shock? Nobody? Nobody looked at shock. Come on, guys.
A life-threatening condition that occurs when the body is not getting enough blood flow.
Okay. And what's the importance of blood flow? And we build in on that. You are correct. It is a life-threatening condition as a result of not enough blood flow. But why is blood flow important? This is not just for you alone, this the group. Somebody tell me, why is blood flow important?
So that
Think about it.
oxygen can get to all the tissues and in the body.
Right. But it's not just about oxygen, right? It's about oxygen and nutrients, but also for the removal of any harmful waste products. So shock, when we look at it as EMS professionals, could simply be described as inadequate tissue perfusion. And these three words encompasses everything there, but you are correct. Okay? Whatever is the problem, it is a life-threatening problem. If you do not get enough oxygen, your body needs oxygen, your brain can only function with oxygen and glucose. So if you don't have one, problems. You don't have both of them, even worse problems. Okay? Good. Thank you. External bleeding. Who looked at that? You guys had 25 minutes to go through it, so who looked at external bleeding?
The loss of blood visible outside the body occurring when skin and underlying tissues are broken by wounds like cuts, abrasions, and punctures.
Cool, I'll take that. And the critical thing there is, well, the critical things are loss of blood, as with any bleeding, but there's a break in the skin. Hence the reason external. With internal bleeding on the other side. Wow, boy, this seems frustrating. This cough is frustrating. With internal bleeding, there's still loss of blood, but the skin is not broken. For example, you get a bruise, you get hit with an object and it's swollen and it's blue black. Your body has lost some blood, whether it's a small amount or a large amount, but it's internal bleeding. The skin is not broken. In the case of external bleeding, there is a break in the skin as you correctly described. We see it. And with external bleeding, we can get an estimate of how much blood the person has lost by observation. Right. Um, what is a first responder? Anybody want to tell me? Nobody knows?
A trained professional or volunteer who is among the first to arrive at an emergency scene to provide immediate assistance. Example, police, paramedics, firefighters.
Yeah, boy, we're looking at the same thing. But we'll look with that. Okay. Just make sure you put it on the chat. Pressure points. What are pressure points? Somebody else. What are pressure points?
So I have areas on the body where pressure can be applied to stop bleeding.
Perfect. For example, anybody give me an area of a pressure point that we can use. Well, that was used previously. Anybody knows? Miss Thompson, you want to jump in here and help them? If you could hear me.
Um, area, the tibia,
Right. So let's use the upper arm actually, between the elbow joint and the shoulder joint. That area there between the muscle, in between the muscle, the bicep and the tricep, there's a pressure point there. If you squeeze tight enough, it was actually one of the areas we would use to help control severe bleeding, severe hemorrhaging in the arm if direct pressure to the limb was not sufficient. Okay. When they're applying a tourniquet, this is one of the areas. In the lower limbs, depending on where the laceration is, or the amputation, or the injury to the limb, that will determine where you apply the tourniquet. But generally, we use the upper arm and the just the area on the thigh there, on the crease there, and the groin by the femoral artery. And it's all about applying pressure to that point to reduce the blood flow to allow the clotting process to start. Okay. Um. So thank you. Emergency medical service. Anybody knows what that is? Who want to take a guess or stab at it? All right. So here what? We'll hold up on that. All right, guys. Let me just minimize here. So I'll get to the definition of emergency medical services shortly. But we have some here, the first responder, the EMT, and recognizing emergencies, the action. I'm just gonna stop the share with this particular item, and I just want to share one part of a screen. Sorry, one part of a PowerPoint. And I'd like you guys to take this information here, right? So this is from one of the programs that I teach, right? This is the Emergency Medical Responder Program. And a core component of it is the description of various levels. So the first responder its name was changed in the EMS system to the Emergency Medical Responder. And we have the description here. I would love to read it out, but I'm unable to because of this cough here. The EMT would be the one working on the ambulance. All right, let's use the public ambulances in Trinidad and Tobago, GMRTT. Okay. Advanced EMTs are just above the level of EMTs. They have additional training. They can do advanced airway. They can give certain medications. You can start IVs. And of course, you have the paramedic, which is basically in pre-hospital care, the highest level, right? And they have various levels of paramedicine. So what would be nice if somebody could actually take a picture of this and put it on the chat, so it would be part of the descriptions and stuff. Let me go back here, right here. All right, so if you're able to take the picture, please do so. And I mean, of course, you'll get it with the recording, but for the purpose of getting the information into the WhatsApp chat, if somebody, please let me know if you do it, so I could take it off.
So I took the picture.
Thank you. Nice. All right, so for all these topics here, as part of Unit 1, this information should be on the WhatsApp group for you guys, as well as what the emergency medical technician, the paramedic and stuff would be. Right, we would have looked at cardiac emergencies. I still have to run the video on CPR for you guys. Would have gone through the scope and information you require with the sample history and all those things. So a lot of these areas of the modules have been completed, right? What I would like for you guys to do, and I don't like to give homework, but it requires, for this part of it, it requires it requires you guys to do some homework for me, right? And the homework for next day, or not even for next day, just get it and you can put it on the chat for everyone. Somebody needs to look at this aspect here on the screen, right? We want to look at the role of voluntary organization, paying particular emphasis on Red Cross, St. John's Ambulance, find out what governmental voluntary organization there is and any other voluntary organization. And let's look at having it specifically for disaster and emergency situations. That's your homework. All right? Looking at the role of the Red Cross, the role of the St. John's Ambulance, any government voluntary organization, or any organization under the government's purview. And then we have any other, such as any NGO. And we're looking at in terms of disaster relief, emergency response, etc. Okay? Guys, okay with that?
Yes, sir.
Anybody has any questions? No? Okay, so I'm gonna start populating probably by tomorrow, putting all the recordings onto. Let me just stop the recording here. Let me pause the recording.